Did meconium and other factors possibly foretell your baby's brain injury at birth? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law in the state of Maryland. And I would like to quickly talk with you today about meconium and why, when meconium is present with other factors, doctors and nurses have to pay close attention to mom and baby. All right, so let me back up. What is meconium? I've done other videos on meconium, but for the purpose of this video, I want you to understand meconium as essentially it's the baby stool. Yep, that's it. Meconium is the baby stool. And so when we're talking about a vaginal delivery, when meconium is present, along with certain things on the electronic fetal heart monitor, which for example can be late decelerations, bradycardia, minimal variability, when these things are in conjunction with meconium, then doctors and nurses have to pay close attention to how well the baby is tolerating a vaginal delivery. See, the electronic fetal heart monitor is a really important tool that is used in hospitals all across the United States, in a lot of hospitals. And this tool is used to help doctors and nurses be able to look at the fetal well-being. In other words, how well the baby is doing during the delivery process. And so if you have meconium, if you have, like I said earlier, late decelerations, minimal variability, and certain other things present, then doctors and nurses have to be ready to move to other intrauterine resuscitation measures to help the baby out. Now, ultimately, if some of the conservative treatments, if they are not working, and the electronic fetal heart monitor is still revealing a non-reassuring strip, then doctors have to be ready to move to an emergency C-section. What can happen is if the fetal distress goes on too long, then you can have a reduced level of blood and oxygen getting to the baby. Now, if we have that reduced level of blood and oxygen, then you may be running into issues like HIE or hypoxic ischemic encephalopathy. And the easiest way to understand that is a reduced level of blood and oxygen, which can lead to a brain injury. So, in other words, meconium, when it's in conjunction with other things, and I briefly talked about them, minimal variability, late deceleration, bradycardia, and other things. When meconium is present with these things, then doctors and nurses have to pay very close attention to the baby. So why have I taken the time today to talk with you about this really important information? Because more than likely, if you are watching this video today, your baby has probably suffered a brain injury. Maybe you have noticed that your baby is not meeting certain neonatal milestones and you are concerned. Maybe after birth your baby was blue in color, or suffered from seizures, or had to be resuscitated, or had to be taken to the NICU. Maybe all of these things were going on, and now you have questions about the challenges that your baby may face going into the future. Well, if you have all of this going on and you would like to speak with me further, this is what I invite you to do. Go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832, or you can reach me toll free at 1-833-4BABY-HELP. If you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer childbirth injury and Maryland medical malpractice questions just like yours all the time, and I'll be happy to talk with you. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law at Boston Law Group, LLC in the state of Maryland. And we will see you next time. Take care and enjoy the rest of your day.